Hello, everyone. Good morning. Happy Sunday. And we are back for a Live mini webinar. I feel like it's been a little bit of time since we've had one of these. And so I'm very grateful to be here with you today. If you're new to my channel, my name is Dr. Val Cacho. I'm an integrative sleep medicine physician, as well as a women's sleep expert here just to talk about my favorite topic, sleep. But really, the reason I started Sleephoria, it's just an online resource for people, especially women, to learn about adequate expert sleep information because there's so much misinformation out there. But also, even though I'm a medical doctor and I have worked in the hospital, I've worked in private practice, most doctors don't get a lot of training in sleep. And there's just so many things to learn about when you're in medical school. And I did a whole sleep fellowship. So that was a 1 year fellowship. Sometimes people can do 2 year fellowships about this. And I've also been working in sleep medicine over 10 years. I think if you count fellowship, it could be 11 or 12, but who's counting? Let's talk today about sleep and stress. Really, we want to talk about, is sleep stressing you out? Learn what works, learn why this happens, and really what to do about it if you are someone who is struggling to get the adequate amount of sleep that you need. And sometimes people know, well, how do I know if I'm getting enough sleep? Because if you're a woman, if you're in your 40s or later and you have a full-time job, you have kids, you have family, and it's really just a balancing act with a bunch of plates spinning. Sometimes you just feel tired all the time. And I want to say it's not normal. You don't have to feel tired, even though you talk to all your friends and they're tired, your coworkers are tired. There are things that you can do. So let's start. First, let's define stress and understand what it is. It's really an adaptive mechanism. If you think back to maybe our hunter-gatherer days, what we think about when we have stress, it's the autonomic system. It's the sympathetic response versus the parasympathetic response. So the autonomic system is a part of your brain. And if you were sleeping in your cave and a saber-toothed tiger, saber-toothed lion came at you, you'd either want to fight, flight, or freeze, right? You want to hide, you want to run away, or you would just freeze. And that's your autonomic system kicking in. Even though we don't have those specific physical threats, I mean, maybe if you were standing on a street corner and a bus was coming at you, that can be super stressful. But sometimes it's more of emotional stress, work stress, life stress due to social things or the way that we respond to our emotions, something called emotional reactivity, which we'll talk about a little bit later. So there's many different types of stress. There's acute stress that can happen after, an event. Typically what I see for people who have difficulty sleeping, it's, their kids, they just had a baby, they're in their newborn stage, or maybe there was a death in the family, unfortunately, or an illness or a new job or a move. Those sort of acute stressors can contribute to difficulty sleeping. Chronic stress, I would say more you're in a job that, you don't really like, maybe you're in a relationship and you want to break up, but you don't know how to, or you want to reconcile and you don't know how to. And then also specific for women in midlife, there's hormonal changes as we go through the change, right? Yeah, as we go through perimenopause and menopause, that can impact your sleep. Caregiving responsibilities I spoke of, career challenges. Sometimes as we get older, we're thinking about, maybe I've been in this job for the past 20, 30 years. Do I want to continue? Do I want to retire? Do I want to start my own business? Do I just want to travel the world? There's so many things to think about. And sometimes these thoughts sort of filter into our mind at night and keep us from sleeping because we're sort of just go, go, go all the time that we haven't actually hit that pause button to help slow down our brain waves to allow us to sleep. So what is the specific physiologic response to stress? So what's going on in your brain and body? And a lot of times, on social media and in sort of pop culture, pop news, they talk about cortisol, and cortisol is really villainized as the stress hormone. If you are interested in reading, there's a great book by Kelly McGonigal. It's called The Upside of Stress. I think it's really helpful how there are benefits that someone can have from stress. But when we take a look at more of the neuroscience standpoint, we're thinking about the hypothalamic pituitary axis, or HPA for short, right? Your hypothalamus in the deep part in your brain sends a message to the pituitary, which has a hormone. So the hormone cascade is the cortical releasing hormone, and then there's the adrenal corticotropic hormone, and then it signals down to your adrenals, which makes the cortisol. And right, so it's not just cortisol, it's the whole cascade. But also beyond that, when we have stress, it can affect our heart rate. Sometimes our heart's racing, our blood pressure can go high, our heart rate can go high. GI symptoms, sometimes, when I get stressed out, I feel like, nauseous, maybe I have a stomach ache. My kids always tell me, when they're tired or they're sleepy, overtired or oversleepy, it's like their tummy hurts. Sometimes they don't have the vocabulary to explain all their emotions. And your immune system can also be affected by stress. So a lot of different aspects of your body. It's talking specifically about cortisol. More cortisol can actually lead to alertness. So the normal thing that can happen with cortisol, right? Because we do have a normal rise in the morning. And the reason for that is when we're sleeping, guess what? We're not eating. Cortisol helps with sugar release, glucose release, tells our kidney, not our kidneys, our liver to say, hey, all right, start making more sugars. Because if your blood sugar goes too low from not eating, it's actually not compatible with life. So that's not a good thing. So there's a normal rise in the cortisol levels in the morning. And this is actually affected by someone's circadian rhythm, your internal clock, whether you're more of a night owl, day person, morning lark, can affect when your cortisol levels do in fact begin to rise. One interesting study giving someone the ACTH, right? So that's the signal for the cortisol, is associated with someone having a longer time falling asleep, less deep sleep, and more fragmented sleep. So not just cortisol of itself. If you stimulate more cortisol to be released, that can happen. But also, guess what? It's a two-way street. Meaning, if you have a lot of stress, it can affect your ability to fall asleep, stay asleep, how much sleep you get. And if you don't necessarily have any particular amount of stress, maybe you're just up longer. Maybe you really enjoy your job. There's a project that you're working on, and you're just sort of not getting an adequate amount of sleep. Typically, less than 6 hours. Some of the research shows 4 hours or less. That can be really inflammatory to your body and cause things like cortisol to go up. So it goes back and forth. Being stressed causes poor sleep. Not sleeping enough can cause more stress levels. One particular study in chronically stressed workers had their cortisol levels checked in the morning for 3 days. And those who were more stressed or chronically stressed, they didn't see the timeline where they considered chronic. But in medicine, we say about 3 months or longer is typically chronic, had higher levels of measurable cortisol as compared to those who reported being unstressed. Typically, you can actually measure cortisol from saliva, which is actually, it's not too bad of a test to do. Yeah. So unstressed folks actually had less cortisol levels, chronically stressed, higher levels, and they broke this down to gender. And then women had higher levels of measurable cortisol in the morning. So you can measure the level of stress that you have. Not always easy to do, but now we have things like heart rate variability monitors that can be helpful for those who are interested in potentially measuring your cortisol levels, right? Alrighty. So also I want to talk about, more recent, there's been talk about this whole idea of sleep reactivity. And what does that mean? Sleep reactivity is sort of like a trait-like degree to which stress can affect one's sleep, whether it be falling asleep or even staying asleep. Sometimes people don't link the issue with staying asleep with stress, but certainly stress can cause that too, right? If you have higher levels of stress, your cortisol levels are higher overall. And then when you have that normal awakening, sort of the normal rise in the morning, you may be waking up earlier. Also, depression is associated with early morning awakenings. So something to consider. I'm going to do a whole video on early morning awakenings because it's something that I get asked pretty regularly. Yeah. So going back to sleep reactivity, those folks who had higher levels of sleep reactivity, maybe more hyper aroused state, more emotionally triggered were to report poor sleep. And the thing about this is if you do have that trait, or if you're more prone to higher sleep reactivity, you can have more of, insomnia. And part of these are like your genetics, family history, female gender, and also environmental stress, right? So females maybe process stress a little bit differently. I'm not too sure, but I think it's also our hormones that can play a role in it. And a lot of the research does show women do have more issues with insomnia and now stress as well. So let's talk about what to do about it. Well, knowing your sleep reactivity certainly can help. Learning about your stress levels, if you want to really get scientific and technical, measure your cortisol. But just check your heart rate. You could use a heart rate monitor, or just check in with your body and see how do you feel. Do you feel tight? Do you feel calm? Do you feel at peace, or do you feel like all tense? And so, if you know how you're feeling, then you can change it. How do you want to feel? When I work with my patients, we do a lot of talk about, cognitive restructuring, because the specific programming in your mind, your thoughts that you have about sleep, can help you sleep or keep you from sleeping. And learning how to shift those, maybe sometimes they're a lot negative. We have a lot of negative self talk, and neutralize those thoughts can be super helpful. Some of the research shows exercise. I know it sounds so simple, but moving your body can help reduce your cortisol, can improve your sleep quality as well. And it's not a lot, a half an hour a day, get your body moving. If going back to the hunter gatherer days, we're supposed to be moving our bodies, not sitting in beautiful air conditioned heated homes, sitting down in front of a computer. I mean, that's just a modern day society, but get your body moving. It's great for improving stress and your sleep. Another thing that I like to do is yoga. I had a patient tell me once, doc, all the yoga in the world isn't going to improve my insomnia. And I'm like, well, what kind of yoga are you doing? And there's specific studies where they look at meditation type yoga, hatha yoga, yoga nidra versus vinyasa, flow, more power yoga. And guess what? When you slow your body down, when you get focused and you're mindful about your breathing, it does lead to better sleep. So, big fan of moving your body, big fan of mindfulness meditation, deep breathing, progressive muscle progressive muscle relaxation is also really good. You're tensing up different parts of your body and then allowing it to relax. Seeking support, talking to other women who are going through something similar can be helpful. Seeing what they're doing, how they're improving their sleep. And if you are looking to join a community of women who are interested in improving their sleep health, Sleepforia does have a community for this. It's a membership. If you want to click on the link below, I do live Q&As. We have, we're gonna have experts coming through on their topics. I'm actually going to interview a meditation expert who's going to talk all about yoga nidra and how this can benefit your sleep. So it's really helpful to just figure out what's bothering you. Where is the stress coming from? If you can help with that, sometimes we can't always change our circumstances, but we can control the way that we react to that. And that in turn can lead to improved sleep. So, all right, ladies, we're going on 12 minutes here. Thank you for those who stayed till the end. I hope you found this video helpful. Comment below. And until next time, sleep well. Bye-bye.